Hi, good afternoon, good morning, depending on where you may be. My name is John Gomez. I am the CEO and founder of Sensato. Truly appreciate you taking time today to learn a little bit more about what we're doing with critical access in rural hospitals. Promise to try to make this as quick and painless as possible, but hopefully valuable to you and give you reason to want to ask questions and engage. We're happy to take any question you may have and try to do the best we can to get you a appropriate and smart answer. So with that, I'm just going to dive into this and kind of go through and talk a little bit about how we put this program together, what the program is, and why we're excited about it. About a year ago, I guess, somewhere around there, so first and foremost, we've been around since 2013 as a cybersecurity firm, specifically in the healthcare space. I'll talk to that a little bit more in the coming slides, but as we continue to evolve and progress, we kept noticing that critical access in rural hospitals specifically, there was no real solution addressing their needs. And we took some time to really try to understand the challenges that that specific hospital segment has, not just with cybersecurity, but overall their operations, their need to attract talent, their ability to retain talent, the fact that there are certainly economic challenges in that space. And with that, we started to think, well, is there something we can do with the solutions that we have to at least support the cybersecurity and privacy side of the equation? And with that, we started to realize there are really three areas that regardless of hospital size or even industry or organization size, that you're trying to make come together. And that is the ability to comply, obviously, with best practices and regulations such as HIPAA and others. The ability to detect threats and attacks is pretty obvious in terms of another thing that has to be done. And ultimately also the ability to respond, right? And doing these three things well, can be somewhat maddening and can take a lot of resources. There's a tremendous amount of effort that has to go into getting all of this right. Now, as we started to learn more about the critical access in rural hospital space, we realized that it was, what we were actually designing and developing over the years really fit really well. And the last challenge we really had was the economics. And I'll come back to the economics in a bit. But that's where what we did is we decided to package up pretty much everything we do into this program known as CARH. And to the best of our knowledge, the Sensato CARH program really is the only cybersecurity solution that is specifically designed to meet the needs of the critical access and rural hospital sector. And I'm going to talk to how we believe that is done and how we do it. We are certainly still learning, and we believe we will always be learning. So if there's a way to improve this program, even if it's not right for you, we would love your feedback. We certainly, are still trying to get everything right, but we think we've done pretty good to at least establish a foundation. At least we hope. So what we've done is we've really tried to develop what we call a full stack solution. So if we think about the fact that ultimately we're trying to help hospital organizations comply, detect, and respond, we needed to find a way that we could do that in a full stack solution. Now, what we mean by full stack is that pretty much all of the different components required to do compliance detection and response are presented or provided in a single solution. Now, the way this works for us and what we've done with the CARH program is we've developed a cybersecurity platform by the name of Nightingale. Now, Nightingale is extremely powerful, and I'll tell you more about Nightingale in a moment, but that is kind of the foundation of our offering. It is a fully integrated software platform. The way to think about Nightingale is it's kind of the Epic or meta tech of healthcare. One of the challenges we see right now in cybersecurity across all industries, not just healthcare, is that most organizations are deploying somewhere between 16 and 25 different cybersecurity solutions, and then trying to figure out how to get all these things to work together and talk together and maintain them and train on them and upgrade them. The challenge has become so serious that IBM has actually called this out as an actual security issue, that there's a false sense of security because organizations keep deploying things, but they don't really deploy them fully because they just don't have all the resources to do that. We kind of took about 2.5, 3 years ago a different turn where we said, we're going to come to market with a fully integrated security platform that completely works out of the box and is good to go, and you don't have to worry about integrating. And I'll talk more about that in a moment, and it doesn't mean you can't integrate other options, but we wanted to really at least give you something that you could deploy and it would work the moment you turned it on. The second thing we saw, and we see this in across healthcare, is that organizations are challenged with, okay, now that I have the software and I've gotten it up and running, who's managing this? Who's dealing with this at 3 in the morning on a Sunday? What are all the procedures and policies and protocols? How do I manage incident response? How do I deal with threat analysis and threat intelligence and keeping up the indicators of compromise and all of that? So we include in the CAR program, in the CAR solution stack, what is traditionally known as a security operations center. We call it a CTALK. I will talk more about that in a few moments. There's a reason we don't call it a SOC. It's not just fancy. We did a lot of research in this space, and we decided to take a very different approach to security operations, but it is included. And then lastly is this concept of guidance and compliance. We found that a lot of the organizations we work with had either outdated policies and practices or needed help with policy templates and some other things in terms of risk registers and policy exception management and some of the things that are on the compliance side, but specific to cybersecurity and privacy, and ultimately create challenges around liability when it comes to things like HIPAA assessments or Office of Civil Rights. So we created this concept known as Sensato widgets. And the idea here is that all of these things are brought together under one solution stack and one offering. And so everything I described to you from this point forward is the CAR program. And everything is included in the CAR program. Now, I mentioned a little bit about, well, the economic challenges. So what we've done is we've really tried to take a look at how do the economics work both for a critical access or rural hospital and obviously ourselves. And we tried to come up with a formula that said, listen, we're going to take a bet on this segment. So we're not looking, and this is, I don't know how else to say this, but we're not looking to make money on any one critical access or rural hospital. We're hoping that with time, as more critical access and rural hospitals kind of look at what we're doing, and hopefully they get excited, they realize that there's power in numbers. And so we're trying to take a very long-term view on return on investment, and hopefully that means that the economics work favorably for any one hospital, but as the segment kind of grows and evolves in this space, hopefully we'll benefit from that. But we'll see. So far, it's been working really well. We have gotten some really strong positive feedback from critical access and rural hospitals, and things have been picking up really, really nicely over the last 6 to 8 months in terms of organizations deciding that this makes a lot of sense for them, and it seems to be a good fit. So with that, let me kind of break down a little bit about how we've approached it. And I've mentioned a little bit about this, which is you can choose single point solutions where the organization has to evaluate different vendors and bring them together and get them to work together. You don't get a common operating picture. You have to work towards that. And it can be rather costly at the end of the day because you have to now figure out how to afford all the different solutions. And our world is really, as I mentioned, having a fully integrated software platform, and then on top of that, integrating in security operations and what we call, obviously, the widgets. And that does enable a common operating picture. And I'll talk more to how that happens and what we do. And I've talked a little bit about how that creates a better economic opportunity for everybody across the board. But with that, we kind of start with Nightingale. Now, Nightingale has 3 key modules. The first module is the compliance manager. And I'm going to go into each one of these and give you kind of a sense of what is involved in the module. What I will say, though, is everything is included, right? We've taken this approach that if you don't want something, then the idea is just don't use it. We obviously we would never force anybody to use anything, but economically it doesn't make a difference. So what I mean by that is, so let's say you said, hey, I don't need the compliance manager. I just want your detection manager, and I don't need your response manager. To be honest, it would be fine. Then we just don't click on those links. And the reason we kind of took that approach is we really wanted to be in a position where we weren't going to play games with clients or prospects where we said, oh, well, we just showed you the platinum version of our product, but all that stuff is extra. So ultimately, the thing to keep in mind is literally everything I'm going to explain to you here. If you decide to ask us for a quote, that quote will include everything I'm about to show you. And actually some things that are new to the platform that we don't even have yet in the PowerPoint slides are part of this platform. So let's just dive into the first module, was the compliance manager. Now, as I mentioned, we started back in 2013. We we do a lot besides just work on the response and software side of the world of cybersecurity. We do penetration testing, we do risk assessments, we do maturity modeling, we do tabletop simulations and incident response. And one of the things that we realized as we kind of were doing all this with hospitals is there are common things that we see hospitals don't have, or if they have them, they're kind of scattered, right? They may have a risk register, but it's in an Excel spreadsheet, or it may be in a PowerPoint, a Word document or a SharePoint file. They may not even track policy exceptions, or they may not have an ability to track threats. So one of the things we wanted to do with this offering, with Nightingale, our software platform specifically, is find ways to help organizations lower liability and increase their ability to defend themselves in a lawsuit down the road if they ever got breached. I am not one to tell you that any one product, including our own, will create 100% level of security. We know that's pretty much impossible. So part of any security program really needs to think about, okay, if that day ever comes where we are breached, then how can we reduce liability? How can we have a conversation with our insurers to increase their payout? And how can we have a conversation with Office of Civil Rights and potentially others that demonstrate we have adopted the very best practices and we did everything we could? Interestingly, an executive order, a law was just signed back in December that actually reduces liability for organizations that can demonstrate they've adopted and done everything they could to protect themselves. So what we did in the compliance manager is we took the 4 big things that we see organizations not doing or not doing correctly and baked them into the platform. And I can go into this a lot deeper, but I just want you to take away from this that we did start to address the major components of compliance. Now, as with anything, if you go buy a full compliance product, probably going to do more things than what we do. But we also try to look at what are the things that you're really going to use day in, day out, week in, week out, and will make an actual difference in terms of defensibility in the future. And that's what we put here. And I'm going to try to, if there's time permitting, to do a quick demo of our platform. So I'll wait till we do that to kind of go a little bit deeper into this. Now, most people that think about cybersecurity and come talk to us, the initial conversations are usually about the stuff on this screen. I will say, so what we usually see as a reaction is people are surprised to learn about the compliance manager. They're also surprised when I talk to you about the response manager, that we have that. And they're typically surprised that we actually offer a level of detection. So detection for us is very serious, the ability to detect attacks. We do a variety of different things to try to do that the very best we can. It starts with our network intrusion detection. Network intrusion detection for us is real-time deep packet inspection. We are really, really deep in terms of the packets. We look at each and every packet on the network at a protocol level. We have 43 protocol analyzers, including HL7 and DICOM. So we see all HL7 traffic on the network and all DICOM traffic. We can tell you who's talking DICOM to who's talking HL7. We can tell you if the traffic's encrypted, non-encrypted. So we've gotten pretty deep in terms of network intrusion detection, and we actually can do a whole deep dive into it if you feel that that would be important to you. But it is pretty deep in terms of what we do. And there's a lot we do there besides just the packet inspection and the protocol analysis, but we can come back to that if there are questions. The second thing is we do perform host intrusion detection. So you have the ability to deploy these little agents to your servers. Now, these take about somewhere in the neighborhood of 3 to 5 minutes to deploy per server. You don't have to reboot the server, and they're designed to not be obtrusive to the server. To date, we've deployed probably well over 1,000 of them. And we've never had anyone have any issue with any of the agents. They run them on EMRs, they run them on financial systems, a variety of different systems, domain controllers. And what they do is they are looking for any event that has to do with with your logs. So this is kind of a neat way that you don't have to worry about log forwarding or doing things with logs. I will talk about that in a moment. But the idea here is you have an agent running who's watching each and every activity that's occurring on that server. It also has the capability to support file integrity monitoring. It also looks for malware and rootkit. It is not a replacement for antivirus. We found a lot of clients already have an antivirus solution, so we weren't looking to compete with that. What we were looking to do is really look at the compliance side of this and the ability to do log monitoring on a server by server or asset by asset basis. And so that's kind of what the host intrusion detection does. We do support and include in our platform a vulnerability scanner. So we have a very powerful vulnerability scanning capability. We can scan classic systems such as servers and laptops, desktops, those type of things. And we also do medical device, IoT, and OT scanning. So that's included. We also are one of the few organizations, I think actually one of the only ones I know of, that have honeypots built into our platform. So we actually deploy honeypots to the environment as part of what we offer. These are fully integrated. The way to think about this is we look at the honeypots as a last line of defense. So if somebody were to get past the network intrusion detection, if somebody were to get past the host intrusion detection, the idea is that hopefully they will trip the honeypots, which will set off alerts. To their credit, the fastest detection we've ever done from the time we deployed our solution to the time we sent an attacker was 15 minutes. That was at a specialty hospital here on the East Coast. And the reason that the attacker was found was a honeypot that we deployed with that client. And the moment, 15 minutes after it was deployed, it found an attacker on the network. So the honeypots are a really important, effective part of the strategy. We also have an asset management database built into the system. Now, this is not meant to replace asset management or tracking that you may have as part of your IT assets or purchasing assets. This is really for cybersecurity and the ability to respond to security events. Now, to support that, we do asset fingerprinting. So we look at the traffic on your network, both dynamic IP and static IP traffic, and we attempt to extract a fingerprint of that device. And what we're trying to do there is determine at least the manufacturer, if not the model, and sometimes the serial number of that device. We add that automatically into the asset management system, and then we're able to correlate things off of that. So it is a pretty rich process in terms of doing that. We found all kinds of things on people's networks, some things you would imagine, some things were a little bit more not nefarious, but interesting, like Xboxes and PlayStations and things of that nature. We can fingerprint about 34,000 different devices and growing. So that is our detection capability. And as I said, this is just scratching the surface. We do a lot more in terms of detection. And we can go much, much deeper into that if anybody wishes us to. The last module that we include with Nightingale is our response manager. And our response manager is really our ability to do incident response. If you remember in the beginning, I said there's really three things pretty much all organizations I know of are trying to do when it comes to cybersecurity and privacy. You're trying to comply with best practices and regulations. You're trying to detect incidents, issues, and events on your network or your systems. And then lastly, you're attempting to respond to them if you have to, right? And so we decided to include incident response as part of one of the modules that's integrated into Nightingale. And there's a bunch of things we can do in incident response. For example, we support active response. This means that if there's an event or something happens, we can take automatic action on that and fire off different applications. We can fire off different scripts. Really depends on what you want to do. I'm going to skip InfoCon for right now and just talk to IR management. This is the ability to actually manage the incident, and I will try it. Hopefully, if we can demo, I'll show you what I mean by that. And then lastly is forensic support. So we have the ability to do forensic analysis within the platform, especially the log data that we produce on the network intrusion detection side, and then obviously we're monitoring log data on the host side. So we have a pretty good idea about what happens when something occurs on the network, and that has a tremendous forensic value from at least an attacker's movement and patterns if they were to get onto the network and you did get into trying to determine where they went, what they did, and how they did it. So those are the three key modules of Nightingale, right? It's compliance, detection, and response. And as I said, all that's included. But the second layer that we talk about, if we think back to that pyramid I showed, was security operations. Now, the way we got into security operations is we had clients coming to us and saying, you guys should build a SOC. And it was really kind of interesting for us because we really weren't thinking that still needed yet another SOC. We were quite happy doing our advisory services, our pen tests and risk assessments and those kind of things. And we were in love with building our software platform, which is Nightingale that I just talked to you about. So SOC wasn't something we were thinking the world needed, as I mentioned. But we got enough people asking us about it that we decided to go out and really take a look at, why are people asking us to run a SOC or build a SOC, a security operations center? And there was a bunch of things we learned, which were kind of eye-opening to us. And that is that, most SOCs, especially third-party SOCs, just don't deliver on their promise. They act very much like a help desk. They throw things over the wall. They, aren't really a partner. One of the biggest things that was eye-opening for us was probably this one here, which is when there's an emergency, they really weren't the partner that the organization expected. They felt that they were being held hostage, right? So all of a sudden there is a breach, and that security operations center that was contracted by that organization, and this we saw happen several times with several different companies and organizations, that's when they said, oh, well, that's not included. If you want, we'd love to help you, but we need a statement of work. We kind of found that to be just disingenuous. If we have a policy as a company right now that whether you're a client of ours or not, if you get attacked and you call our security operations center, which we call a CTALK, they're going to help you. They're not going to ask if you're a client. They're going to support you. They're not going to ask you to write a contract or sign a statement of work, because we believe there is something here that ultimately we need to be partners with each other, and some things have to transcend the contract. So we just found a lot of the things we learned as we researched SOCs to be surprising. We just didn't think they operated that way. And I guess, it's why people were asking us that we should go build one. And we did. Now, when we built it, what we built is something known as the Cybersecurity Tactical Operations Center, or CTALK. And we took a very different approach to, I guess, a SOC, right? We renamed it something differently, but it's not just a difference in the name. The CTALK actually is a very different animal. We built it from the ground up to support critical infrastructure organizations, specifically healthcare. We took a lot of our practices from the military and their creation of Tactical Operations Center. It really focuses on kind of doing three things. And there's, again, a lot more than time permits for us to go into what it does, but I will touch on each of these. But basically, the CTALK does do continuous monitoring, continuous intelligence, and continuous support. And again, everything I'm describing right now is included with the CARH program. So this is not an add-on. This isn't a, oh, well, you can get the software, but for an additional X amount of money, we can throw in the security operations center. We've really tried to build a full stack solution. The first thing is continuous intelligence. So the CTALK is a real place. It's here in New Jersey. We monitor our clients across the United States. We have really good relationships with a variety of different organizations. Sensato itself is an information sharing and analysis organization. We are an ISAO, so we do have relationships with DHS and FBI. We work very closely with the New Jersey Cybersecurity Communications and Integration Cell, which is a part of the New Jersey State Department of Homeland Security. We have access to ICS CERT and CISA. We actually have servers in our facility that trade classified intelligence back and forth. I'll talk more about some of our threat sources, but the CTALK is doing threat analysis 24/7. We do reputation monitoring. One of the things that we do is something known as a TAC alert. This is a situation where we see something happening in the healthcare sector or something else happening that we think you need to know about. They will issue a TAC alert. TAC alerts are pretty easy to read. You'll get them in email. They're not meant to come out every day or every week. They're really meant to be something that when you see them, you know that this is pretty serious and you need to check it. The TAC alert can evolve into something known as a threat intelligence briefing. The TIB is actually an actual briefing, what you would expect from something like NSA or CIA. We actually take how they do their briefings, follow their pattern, and we actually will do a briefing. Some of the briefings are classified, so you're requested not to share the information, or there's certain, depending on the level of classification. We can send you examples of some that we've done, so you get a sense of how those go. But this is where the threat is much more serious, and we need to have a conversation with you and others. And so these are much more in depth. And then the last thing we have as part of this part of the CTALK is what we consider a virtual war room. This is something where if it's a fast-moving or evolving situation, we will open up a 24/7 war room. You can participate as much or as little as you wish, but the idea there is you know that you can jump on this war room at any time, and there's going to be an analyst there that will be able to answer questions, provide guidance. The last time we used the war room was for the coordinated attack against healthcare, which was just several weeks ago, I guess about 2 months ago. And we actually kept that open for about 72 hours, supporting our clients. And so those are kind of the intelligence capabilities. There's more to it than they do, but just to give you an idea that that's part of what you get. Obviously, the monitoring part of it is a big deal. So we do threat detection based on what Nightingale, our software platform, sees. So the CTALK is going to go ahead and analyze those threats, prioritize them, work with your organization to respond to them, and think through how to deal with those. So that's one piece. CTALK can also run vulnerability scans. They will develop a scan plan with you, and so they will go ahead and execute vulnerability scans, analyze the results, help to prioritize them, and help kind of figure out how they should be addressed and how you should mitigate those things. So that's part of what they do. There are environmental recommendations that'll come up. So things like we see these servers either going out, or you may have expiring certificates or some other things that may be environmental based. The CTALK will support helping you with environmental issues that are or typically could cause security or privacy issues. And then obviously if there's anything related to HIPAA, they will call those things out so you have a heads up to them. And again, kind of helping make sure that we keep you out of trouble. But if you get into trouble, we can minimize the damage in terms of liability and things of that nature as best we can. Again, there's more to the monitoring in terms of what they do. Another thing is you're not left alone. So you can call the CTALK at any time, 24/7. And what I mean by that is, let's say you had something occur on your side that we didn't monitor, or we're not seeing. For example, somebody leaves a laptop in a car, a hospital laptop, and somebody breaks a window and steals that laptop, and you're thinking, oh man, what do I do? Or I'm not sure, or maybe you get the laptop back and you're not sure, was this thing compromised? What should I do with it? What shouldn't I do with it? And this is a common example, so most of you probably know what to do, but I just want to use this because this is outside the purview of most SOCs, which you don't have a SOC, you have a CTALK. So you can call them and say, hey, look, we just had this laptop stolen. What do you guys think? Or we just recovered this laptop. So-and-so left it, and then they went back and got it, but they think somebody got to it. What do you think we should do? And there's a bunch of things the CTALK can do for you in that situation. We do tactical forensics as part of the program. So they could say, hey, why don't you ship us the laptop? We'll do a tactical review of it. We'll do a forensic review of it and see if there's any reason for concern. You can have an insider threat. We just had a hospital where, because of the COVID vaccines, somebody inside the hospital decided to play some games with the scheduling of vaccinations. And they weren't really sure how this person did it, but they know they did it. So they asked us, could we in any way, shape, or form help? And the answer is yeah, let's see what we can do. So that's all included in the CTALK. We don't send you a statement of work and say, oh yeah, we'll help you with that laptop, but here's a statement of work. Or hey, if you want us to look at that insider threat. We don't believe that's a partnership. We believe that's a vendor. And we're really, really very serious about trying to grow partnerships and, more importantly, friendships at some point, but we know we have to earn that trust. Everything I'm talking to you about right now is what we consider continuous overwatch or continuous support. And this includes things like governance and having meetings with you on a monthly basis to understand what we're doing right or what's going wrong or how we can improve or how you can improve. We've talked about incident response. The CTALK shines at incident response. We have protocols in place for supporting incident response at a very detailed level. We take a very different approach to incident response. It's what we believe to be more effective than what others may be doing. I guess that's debatable. I'll talk more about incident response in a moment. We do case management, which you would expect of anyone. But the guide support stuff is what I was just mentioning. We will answer questions. If you're looking to buy another tool, we'll have people say to us, hey, we're thinking of getting these 2 or 3 antivirus solutions. What do you guys know? And if we don't know something, we'll reach out to other clients and ask them, are they using those tools, and then get there and hopefully put you in touch with them. I will give you one very clear example of what we mean by Overwatch that occurred during COVID. There was a hospital that's a client of ours who had a situation where they were overrun with COVID patients. Their PPE ran out, and they needed more personal protective equipment. They had looked at their resources, the state resources. They couldn't find PPE. This is a hospital that is kind of an inner city, so their resources are limited. They don't have a lot of staff. They were doing the very best they could to support their community. And on a whim, the CIO contacted the CTALK, and it was after hours in terms of normal business day, and said, is there anything you guys can do? And, I don't know if they really expected us to, but everybody always hears, hey, we'll try to do whatever we can to be helpful as much as we can. And I think they were just taking a shot. So when they reached out, I think they were surprised to hear that, hey, let's see what we can do. We put out a call to all of our clients as well as all our government contacts. Lo and behold, a CEO in Southern California whose hospital had extra PPE, they hadn't been hit as hard as the East Coast at this point in time, responded back to the CTALK and said, hey, listen, we've got some extra PPE, we'd be happy to ship it if you can help us get it there. The CTALK then coordinated the logistics between these 2 hospitals and had the PPE sent out to this hospital on the East Coast. And lo and behold, it did make a difference. And I think that's that example speaks to what we ultimately want to be in terms of a partner. And it's not just about the cybersecurity stuff. And we this is going to sound arrogant, and I really don't mean it to, but we are really good at what we do. But we also know that, at the end of the day, beyond the contracts and all the bells and whistles and bits and bytes, there are humans involved. And we really believe that at some point we want to make a better difference in people's lives. So, the other thing is the widgets, which are basically policy templates. You may or may not need these, but they are included if you say, hey, we don't have a risk management policy. Do you guys have a template for that? Or do you guys have a template for a vendor assessment framework or a vendor risk framework? If we have it, we're happy to share it with you and give it to you. If we don't, and we can throw one together for you, we will. But the widgets are part of what you get. The other thing that some people find surprising is that part of the CARH program and what we include is a full medical device security program. And I mean a truly full medical device security program. So our Nightingale software does support identification of medical devices, threats against medical devices, obviously if they're connected to your network. The CTALK will do vulnerability scanning with medical devices. They will coordinate that with people on the ground, meaning that if you have an MRI and it's being used during the time that we're going to do a scan, they will coordinate with your end users. They will reschedule the scan. So the CTALK is a healthcare aware and specific security operations center. I don't like calling it a SOC, but just to keep the nomenclature clear. So they understand how to do this. We call that program MDCOP. It is the only program today that we know of that meets or exceeds all of the FDA requirements for medical device security that was published out in October 2008, or I shouldn't say requirements, recommendations, sorry. But it does address each and one of these areas. If you'd like to know more about what MDCOP does and how it works, happy to either send you that information or do a conversation with you. But the key takeaway is this isn't just, hey, let's go monitor your IT network. We are looking at how do we support the overall challenge presented to any hospital, but especially want to make sure that when it comes to critical access in rural hospitals, we include that. Overall, Gartner has given us positive feedback in terms of what we're doing, our software platform. They seem pretty excited about it. CLASS, if you're familiar with CLASS, they rate organizations across a variety of different vectors by talking to that organization's customers. This is a high-level snapshot of where we ended up, and so we're pretty much above average, pretty good amount of numbers, so pretty happy and excited about that. So we've been trying really hard to maintain the level of excitement and what we say pre-sales really know that it matters post-sales. Some questions you may have are around, what about deployment? How long does this all take? And it sounds like a lot and it seems overwhelming. It could be, and we understand completely that, hey, a lot of critical access organizations or rural hospitals have 1, 2, 3, maybe 4 or 5 people, if that, in their IT department. So we've really worked hard to kind of figure out how do we deploy our product in a way that is respectful of those challenges. So on the right-hand side of the screen, you kind of see our methodology, but I'll give you some specifics. We have a program called TPW. I know it's a lot of acronyms. It's about a 16-hour workshop. This is scheduled around your schedule and your resources schedule. So it could be done in 2 days, or it could be done 2 hours a day for however long it takes. During that workshop, we will do a bunch of training with your staff, but we will also do the planning and deployment. So deployment planning. And so all of that is done then. The actual deployment of the platform. So there are physical components that get deployed to your environment. Those typically take less than a day. And part of that TPW workshop that we do walks through how to get everything staged and ready so that it's a very minimal amount of work that has to happen when these things get deployed. We pre-build them, we test them, we do everything at our facility, we then ship them to you. Our team will then Teams meeting and walk through how to bring them online. 99% of the time, all you have to do is rack them, plug them in, and connect them to the network, and then turn on the power. Once the power is turned on, they will call home. We've developed what's called over-the-air services framework. So all updates, all threat intelligence, everything is managed by the CTALK remotely. You never have to touch the devices other than the first time to turn them on. So we've kind of worked really hard to minimize any impact on deployment. And like I said, we can typically get people up and running on the physical platform in less than a day. Usually, the contract's going to say, a day. It typically takes 2 to 3 hours. And then we continually work with you. Like I mentioned, there are meetings that are held at least once a month, if not more frequently, to just talk about governance and progress and objectives. But you're in touch with the CTALK almost every day in terms of dealing with whatever is coming up and whatever has to be addressed. So there's a lot that has gone into thinking about how do we not only minimize the impact on deployment, but also maintain a level of service that really has you being happy. The economics, obviously we need to know about your environment. So it really comes down to kind of how many devices you have and your network traffic. And what helps us get to a really clear understanding of the economics is a network topology, so we understand kind of how your network's laid out, and it could be just a drawing if you don't have a formal Visio or whatever you may have. And then how many devices, how many IPs are we talking about, and how many of those are medical devices that are connected to your network, how many are servers, and then your average network traffic levels, both average sustained and then average peak. And we have a questionnaire that we can provide you if you're interested that will help guide you through that. And then we can turn around a proposal to you. The pricing is subscription based, so we typically, it's a recurring kind of invoicing program. And so, that's kind of how that works, but we're happy to tell you more about, all of the details around that, if that's of interest to you. A little bit about us, we, as I mentioned, started in 2013. CTALK started back in 2016. We worked on Nightingale starting in 2018, it's fully deployed and working to protect hospitals as we speak. And then we came up with this concept of the full stack, bringing everything together into one solution back in 2020. When we did launch the company, we launched as the first healthcare specific cybersecurity firm. There's been a bunch of stuff we've done and really are proud of since then. I mentioned we do a bunch of other things beyond just what I mentioned on the car. We have some amazing partners. We are the cybersecurity partner for a variety of different hospital associations across the country. So we've gone through a lot of vetting and diligence to kind of become their partners. On the right-hand side of the screen here, you'll see some of our partnerships. I mentioned one, which was the ISAL, that we are an ISAL. This can help with insurance and sometimes helps with some other things. For us, it does give us access to a variety of assets that most organizations don't have access to. And the other thing that we have is a memorandum of understanding with the Food and Drug Administration. This memorandum of understanding, really what it is we really focus on helping FDA to address and respond to medical device threats. We will work with them in a tactical capacity, meaning typically in the first 72 hours of a medical device security threat. We have presented with FDA. I can share those presentations with you when there have been threats. But you know, we take our role pretty seriously in terms of everything we do, and we try to put in place the relationships so that you know that hopefully you have a partner that can support you in some of the most challenging times you may ever face, which hopefully you never will. Oh, one thing on the response thing that I did not mention, a lot of organizations talk about incident response, and what they're talking about is IT response, right? So you have a breach, you have some kind of incident, and they're really dealing with your IT organization and helping figure out the IT stuff. We do that, we do all of that, as you would expect, but we believe in going beyond IT. So if you have a situation where you're saying, hey, we just got breached and we need you to talk to our general counsel, we need you to get on the phone with one of our partners, one of our BAs got breached, you know, we need to talk, you know, what should we do? Should we call the FBI? Shouldn't we? Should we talk to your marketing or crisis communication team or whatever it may be that you have? And obviously for critical access hospitals, you may not have these things. So we support those roles, we will do that. So we call that beyond IT incident response. Please know everything we just talked about, you can decide you don't need all that. You don't want to turn that on. You don't need us to do beyond IT incident response. We will mold ourselves to whatever you feel is right for your organization. And so what we're trying to do is let you know you have this full menu of services, and as part of deployment and planning, you know, you can decide what you actually need off of that menu, but the economics don't really change regardless of how you do it. And you can also do things and say, hey, we're not going to do that right now, but 6 months from now, we're going to start doing that, and you don't have to worry about, okay, now we'll come back to you with a new proposal in 6 months. So that's kind of the CAR program, and it's pretty much everything we have in terms of the actual application itself. I'm not sure if there are any questions, but happy to take them if there are.
John, we don't have any questions at this time, but if anyone does have a question, you can enter it in the questions pane on your control panel. We'll be happy to answer those. It looks like there's no questions right now.
Okay, great. So if you do have a question, if something comes up, our contact information is on the screen. You can also reach out to me directly at john.gomez@sensato.co. Yeah, I'm sure my team will follow up with you directly just to see if you would like to talk more about how we're evolving, what we're doing, and if we're a good fit for what you're working on. So with that, truly appreciate your time. Really hope that we do have an opportunity to get to know you better. And we'll hopefully be talking soon. Thank you.